Hello, Brandon Valley High School anatomy classes, and hello, Mrs. Fuscello. Hey, thank you so much for this opportunity to visit with you today about chiropractic. My name is Dr. Miles Dixon. I'm a doctor of chiropractic and also Brielle Dixon's dad. Hey, Brielle. See, just really want to share with you what it's been like and sort of my experience being a chiropractor. And so, I've been in practice for 23 years and have been in Brandon now for 20 years. And the clinic that I'm at is called Invive Chiropractic. And so we have a clinic right here in Brandon on Holly Boulevard by Blaine's gas station. And we also have a clinic in Sioux Falls, Howard, South Dakota, and Ontario, Canada. And so, let's just chat about, hey, what is it that a chiropractor does? And so some of you probably have had some firsthand experience, and I know that some of you probably haven't. And so, what chiropractors do is this. People come into our offices and they've got a problem that they want to solve. And that problem may be that this is a young mother and she woke up one day, bent over to put her socks on, and her back started to kill her. And ever since then, she's having difficulty picking up her 2-year-old. That's her problem. She's not really so much concerned about the diagnosis. She just wants to get her problem solved. And so chiropractors, like many other healthcare professionals, will take a history and really gather data as to what happened with the patient, what's their story, so to speak. And that's just a process of really listening and then asking some pointed questions and really getting those data points. And then we follow that with a physical exam to really determine what's the ultimate cause of this. And so what makes chiropractic unique is that we really focus on identifying the cause of the problem. And so we'll do some different tests, which would include things like just observation. How is this person walking? Are they having difficulty walking? Are they standing in an awkward position? What does their flexibility or range of motion look like? We would do some muscle testing to check their muscle strength, really palpating the area and areas around it to see if there's any muscle hypertonicity or spasm or tenderness, followed by some reflexes and a host of other tests. And one of the other tests that we do is called the surface EMG. And so I provided some handout for you guys to check out. And this surface EMG here really measures the electrical activity of the muscles surrounding the spine. And it really gives us some important data. And we'll cover that more in a little more detail here in a few minutes. But once we really find out what's causing this problem that this young mother has, then we'd just like to sit down and just have a conversation and really sort of pull all the pieces together here and really help the patient understand and answer maybe some of the questions that they have, which may be the following. Hey, what happened here? Right? Because all I did was bend over to put my socks on, right? Why did it happen? Why to me? Why now? What should I do? And what will happen if I do nothing? I mean, those are some of the common questions that we get. And so we want to make sure that we're addressing those questions along with really explaining what's causing their problem. And then, of course, the solution. And, so really the definition of chiropractic, it's the art, science, and philosophy of identifying or detecting vertebral or spinal subluxations and then correcting them. And the reason that that's such a significant thing is because these spinal misalignments really affect the function of the body. Because the spine is so tightly correlated or related to what's happening in the central nervous system, it really can have a big impact on a person's overall health. And through the latest neuroscience, we know that spinal subluxations affect the function of the brain. And it's a really fascinating and interesting development really in recent science here. And so what I mean by that is that, let's take a look at this scan here. So that EMG scan, what you're seeing there is you're seeing that the green colors are normal, okay? And where you see red, that means there's severe overactivity or tightness or excessive firing of the paraspinal muscles. Purple means moderate. Again, green is the ideal color, it's normal. But the worst color up there is yellow. And so what yellow suggests is that there's an underactivity of that muscle tone. And the purpose of these muscles, their job, so to speak, is that they're spinal stabilizers, okay? But what we now are really discovering is that their major role is that they're sensory muscles, right? In other words, they're sending sensory information locally. So you see those yellow colors down there at the bottom on this individual? That yellow means that the sensory input to the brain is affected. In other words, the lower back isn't telling the brain what's happening locally accurately. Okay, so how that plays out is that when a person's doing certain movements, your core muscles need to engage. Your big stabilizing muscles need to engage. And when there's yellow areas down there, that area is not telling the brain to kick those big muscles in. Okay, so it really affects an area of the brain called the prefrontal cortex. And it kind of flips that part of the brain off. And what it also does is it can really lock a person into the stress mode. Okay, so I don't know if you can see my hand here, but my thumb kind of represents the stress area of the brain, maybe called the primitive brain, right? So when a person gets scared or something like that, or is in a stressful situation, this part of the brain fires, okay? And the front part of the brain, where my fingers are, that's called the prefrontal cortex. And its role is to really, it's the logical part of the brain. And so it really helps to, sort of filter the information that comes in. So imagine that you walk into a room and there's a coiled up rope on the ground, right? And it looks like a snake, okay? Well, when a person's in this stress mode, okay, and that front part of their brain is shut off, the person sees that as a snake, right? And may really go into a stress mode, right? But the job of the prefrontal cortex is to simply say, hey, you know what? That's just a rope down there. No sense to be alarmed. We can shut down here. Everything's okay, right? So when a person has dysfunction in their spine, it affects the function of the brain. It locks them into that stress mode. And of course, that has a negative effect on a person's overall health. And so, chiropractors, their role, oftentimes, people view us as someone who fixes neck and back pain. And certainly a majority of our patients have low back pain, neck pain, headaches. That's probably the majority of the people that we see. But chiropractic treatment really affects the overall well-being of a person, their overall health and function, because its impact on the central nervous system, in particular the brain. And so I don't want to get too far into the weeds on that, but I think it's just a really cool thing, and it kind of explains really how and why chiropractors can help so many other things besides just neck and back pain. And so once we identify those areas in the spine, we use a treatment called an adjustment. An adjustment can be done several ways, but its purpose or its intent is to really restore the function to the spine, to get the spine moving properly again, to get the spine adjusted or realigned in the proper alignment. And we can really do that a couple different ways. One way is the traditional old school technique where we do it by hand. And so we'll apply specific techniques with a certain amount of force and a certain amount of speed to really be able to move or realign that area or that vertebrae. We can also use an instrument. And so I'm certified to use an instrument called an activator. So this is an activator, and this is sort of the latest version of this technique. And so how this works is it provides a very quick impulse into the spine, okay? And it's about 30 times faster than what I can do by hand. And so that means we don't have to use as much force. We use more speed than force. So it's a more gentle way to adjust the spine. And so we have some patients that prefer that. We have some that prefer that we do it by hand. But in the majority of people, we do a little bit of both. And so again, that's called an adjustment. And so, when we go back to this scan that I gave you a copy of here, in this particular individual, what's really interesting is that this person came in here with really no symptoms. And this person's an athlete, and so their objective here is that really they don't want to have any problems, right? But what we can see here is that we can predict future problems in the spine by doing an evaluation and an assessment. And in particular, this scan. So the yellow areas down there indicate that there's going to be a future problem in terms of pain. Pain's going to show up eventually in this person in their lower part of their back. And so it's really cool that we can catch that in advance. And so this is a person that we're doing some treatment on. And so once we go through and we talk about, hey, what's the problem, the cause, and the solution, we'll set them up. The solution really is a treatment plan. So we'll prescribe a treatment plan, and it may look something like this. We're going to give this some time. So this is going to take some time to heal. And so we're going to start off with a 3-week treatment plan. And we're going to do these adjustments with some repetition, much like an exercise program, at the frequency of 3 times a week. So three treatments a week over a 3-week period, and then we'll check the progress, right? And see subjectively, how's their pain if they have any, right? Objectively, how are things healing or functioning? And really determine, have we met this person's goals? Are we done? Where do we go from here? So that's just a little bit of an overview as to what it is that we do. And, the next thing I wanted to go into is what's the chiropractor's education? And so I know that you guys sent in some questions, and I'm going to get to those questions shortly here. But on the back of that handout that I provided, I simply printed out the requirements for Northwestern Health Science University up in Minneapolis. And that's where I went to chiropractic college. And so they have just an overview of what's really required in terms of the minimum credits required to get into chiropractic college. And so, you'll have to obviously go to undergrad. And, when I went to chiropractic college, I took the bare bones minimum classes to be able to get into chiropractic college. But nowadays, most states, in fact, I think all states, require that you have a degree, an undergrad degree. And typically that's, a Bachelor of Science or some degree similar to that. And you're required to have that to get a state license. You're not required to have that to get into chiropractic college. And so you can sometimes combine your classes in chiropractic college to earn that Bachelor's of Science degree. But anyways, it's a minimum of 90 semester credits at the bachelor level, and the required course is 24 semester credits in life and physical science. At least half should include a lecture and lab component, and those include general chemistry with lab, organic chemistry with lab, biology with lab, and the minimum GPA is 3.0. And so, when a person decides that, hey, I want to go to chiropractic college, you really want to make sure that you meet with your counselor at whatever college you choose, and that you really get the appropriate classes that you need to get into chiropractic college. And I would also say, make sure that you become your own advocate. In other words, do your own research, right? You can get online, you can contact the chiropractic colleges, and really make sure that you have this thing laid out so you know exactly what classes are required. And so, when I read through that list, one of the things that you noticed on there that maybe wasn't there was anatomy. And so I went through all my undergrad and did not take any anatomy. And I can tell you that hurt me, because when I got into chiropractic college and took anatomy, it was difficult. There was just so much information to learn. So that's one of the lessons that I would say maybe you can learn from my mistake, is really make sure that you're taking some anatomy like you are now. So good work on that. But yeah, a little bit about my story here is, when I was in high school, I was a poor student. I was really focused on sports and having fun, and didn't place a high value on my education and my grades. And so therefore my grades weren't good. And also when I took my tests to get into college, I scored really poorly on my ACTs. And so I made a decision that, hey, once I knew I wanted to go to chiropractic college, I decided to go to a community college where I knew no one, right? So I wanted my focus really to be on my studies. And so my first semester was difficult, and I remember having some challenges. but I just put my head down and got to work. I worked with my instructors and eventually got on the dean's list, and which was a big deal for me because I was a C and D student in high school, except for gym where I got A's. But nonetheless, I ended up getting good grades in undergraduate and got into chiropractic college. But it was difficult for me, and I was an average student in chiropractic college, and I got A's in my technique classes, but everything else I was average, and it was a struggle. I mean, I had to work hard. Keep in mind, in chiropractic college, you're taking 25 to 30 credits a semester, which is really a full load, right? I mean, it's a full-time job. And so anyways, I practiced in Spirit Lake, Iowa for 3 years, and then in 2000 moved to Brandon, and I've been here ever since, and we love it here. So let's go through some of these questions here. Question 1, do chiropractors get to the point in their career that when they are feeling the muscles on someone, you would be able to picture the muscles through the skin? And the answer to that is yes. And really, that is something that is really done more through palpation. So yes, in a certain sense, I can visualize those muscles, but most of that input is really coming through palpation with my hands. And that was a skill that really took some time to develop. We worked on that hard in chiropractic college, but the answer to that is yes. The next question is, how does fat affect your assessment? And if I read into this, I think what the person's asking is, hey, if you've got someone that's obese, is it difficult to work on that person? Is it difficult to palpate or feel those structures? And the answer is yes, it is difficult. But gosh, I've done it so much that I really don't even think about it now. So you just have to kind of change things a little bit. Again, it's sometimes it's more of a visualization, like the prior question alluded to. But yeah, it's can it be challenging? Yes, of course. The next question is, since we students sit in chairs all day long, what would be the ideal position we should sit in and develop or maintain good posture, or what position should we avoid sitting in? And so, ideally, first and foremost, sitting is not good for us, and the studies that have come out really indicate this. I mean, it's not good for us, to the point where they really correlate, the studies correlate this: sitting is the new smoking. That's how bad it is for us, right? And so when we are in a position where we have to sit for long periods, of course your posture is important. And so you could sort of think of it like this: the position that you would have to put yourself in to balance a book on top of your head, that's the posture that you'd want to be in. So your shoulders would have to be back, your head centered over your shoulders, your spine erect and upright, and that's really the ideal position. The position that we should avoid is the position where we're slumped, where our head is really forward. That really puts a lot of undue stress and load on the spine. Next question is, would you suggest to try to fit 4 years of college into 3 years and then going to chiropractic college for 2 years, or do the regular 4 years of college and 2 years of chiropractic school? So I didn't read that really great, but again, going back to what I alluded to before, you really have to have that Bachelor's of Science degree. So you'd want to make sure that you get that degree in undergrad. And then chiropractic college, and so let me go back. Undergrad, you could do like traditional college where you take the summers off. That's what I did. But when you get into chiropractic college, it's 10 semesters, right? So it's 3 1/3 years, and you want to go straight through, right? So you may have a week or two break in between those semesters, but I wouldn't encourage a person to take the summers off, so to speak. So I hope that answers the question there. Next question is, why did you choose to be a chiropractor? Well, my father's a chiropractor, so I grew up with this thing. So it's sort of second nature to me. But as a young kid, I spent a lot of time in my dad's office around his patients, and many of those patients would drive 2-3 hours to see my dad, and in fact, they'd stay in a hotel overnight. And I got to hear their stories, and I got to really hear sort of their admiration for my dad and how much he was helping them. And I just also knew that as a kid and as an athlete, I didn't get injured very often. If I did, my dad took care of me. I was sick, very, very rarely was I ever sick. So I just knew that that lifestyle was something that I really enjoyed. My dad is really successful, and so I knew that I wanted to have a career where I could be successful and earn a great income like my father. And so those were the main reasons. But I just loved how my dad was able to help so many people. What's a typical day like? Well, when you go to chiropractic college, they teach you how to be a technician, and how to really be good at your craft. But they don't teach you how to be a small business owner. And many chiropractors are small business owners like I am. And so, we've got to operate and manage a business. And so, to break it down here, 26 hours a week, I'm seeing patients. 10 hours a week, I'm doing managerial tasks. I'm leading a team. I'm doing the operations of a business. And then about 4 hours a week, I'm doing entrepreneurial skills, which include, really dreaming about, hey, where do we want to go from here? And really investing in myself and learning, and reading. And I do a ton of reading and training every single day. What courses, let's see, would you take if you were interested in becoming a chiropractor? So again, go to that handout I gave you that talks about the requirements that you need to get into chiropractic college, and especially taking anatomy. So I think that's such a crucial course to make sure that you take. Let's see here. What's a typical day like? Let me go through some of that more. So day in and day out, when I'm in clinical hours, those 26 hours a week, the majority of the time I'm adjusting people. And so people are on a treatment plan. They're coming in to get adjustments. Those adjustments in their initial intensive treatment is typically 3 times a week. And so there's a lot of people that I'm adjusting each day. The other thing that I do is meeting new patients. So I'm involved in taking that history, doing that examination, and then relating the findings, and then really talking about and explaining to the patient the problem, the cause, and the solution. And my team does a fair amount of that as well. So that's sort of a typical day. Let's see here. What do you have to do to crack someone's neck or back? Well, that's what we call an adjustment. And so, there's certain techniques, and in each region of the spine has a different technique in how we do that. But essentially, we're loading the spine up and we're putting pressure in the direction of correction for that misalignment. Or we're finding the area of restriction in that motion segment in the spine, and then we're applying a specific force or pressure. And for that cracking or popping sound that you're alluding to here, for that to happen, we have to take the joint to its end play and then push it a little bit beyond that. And because the spinal joints are synovial or fluid filled, there's nitrogen gas within those with those fluid pockets. And so when there's enough force placed on that motion segment, the gas is released. And so it creates that audible crack or popping sound, which, by the way, is not therapeutic, okay? What's therapeutic is really creating that force in the right direction to be able to realign that segment. Let's see here. The last question is, why are most chiropractors anti-vax? And what that person's getting at here is vaccinations. And so I would say that I wouldn't agree that most chiropractors are anti-vax. I would say that certainly some are. And so, this is a topic that, of course, is controversial. And so I myself have not been vaccinated, and that's a decision I've made through doing research and sort of being my own advocate on my own health. But my license does not allow me to give advice one way or the other on any medication, including vaccination. And so that's not something that I speak with my patients about very often. Of course, people will ask me from time to time. And so how I can preface that is just really telling them, hey, just make sure you do your own research, right? And I can share with them my experience and what I've chosen to do, but I can't give them specific advice on what they should do in terms of vaccinating themselves or their families. So hopefully that helps answer the question there. I'd like to just sort of wrap it up here by telling you a little bit of a story. And, several years ago, a young Augustana football player came to my office, said, hey, I'm thinking about going to chiropractic college, and I'd like to come in and observe and just kind of see how things operate. And he was he was persistent. Let me put it that way. And so I invited him to come into the office and observe, and he persisted to ask, hey, is there a possibility that could work here? And so we made a decision to invest in that young man. And we just knew his passion, and really, really his character was something that aligned with our values. And so he worked for us for a couple of years as he was in undergraduate school. And he got to see firsthand what is it that a chiropractor does day in and day out, and just really learn some valuable lessons in every aspect of the office. And so we trained him in many of those different positions. And then he went off to chiropractic college, where he continued to work for us, continued to do some things, some back office things and work for us. And the really cool thing is that by him going to chiropractic college and investing in the time to be able to work in a clinic, he knew that he had a job when he came home, right? So most of his classmates, they didn't know what they were going to do after chiropractic college, racking up a significant amount of debt. They didn't know what they were going to do. Well, this young individual named Cole knew that he had a job. And so he is Dr. Unruh's successor in our Sioux Falls office. So he is now graduated. He's working in our Sioux Falls clinic. And so I think this story is so valuable because what he's done is, again, invested in himself. So whether you're going to go to vet school, whether you're going to be a nurse, a chiropractor, whatever you decide that you want to do, I would really encourage you, go find somebody that you want to model, right? Find somebody that you look up to that is doing what you want to do, and at minimum, go visit with them, right? But it would be great to be able to work in that environment. So instead of a summer job working at a coffee shop or something, why not see if you can get involved in work in that clinical setting? Whatever it is, right? And spend some time, because how a business or a career looks from the outside and how it operates from the inside can be two different things. So because you're going to invest so much of your time and energy and money into a profession, why not take the time to really see and learn how it operates from the inside? So I just thought that was a brilliant move by Dr. Snyder. And I think it would be something that would be great for you guys. And it's something that I talk to my kids about frequently. Make sure you go and meet those people that you want to be like. Because that was an invaluable education. Not only was he able to earn some money, but the value of the education that he got during that time was really awesome. So anyways, I just want to encourage you guys, you're at a point in time where you've got to start to make some decisions about your career path. And, when I decided to be a chiropractor, I made the decision, right? There was no backup plan, right? And so sometimes people say, well, make sure you have a backup plan. And I guess my perspective is, don't have a backup plan, right? Because oftentimes when you have a backup plan, if things get a little uncomfortable, well, you start to kind of shift towards that backup plan, right? And it's going to be uncomfortable, whatever you decide to do, right? But make a decision and follow through. And if you're going to change your mind about anything, change it now, right? Change it now through the experience of going into that business and observing and seeing, is this really something I want to do? But then make the decision as to what it is that you want to do with your life, and then go all in. And so anyways, hey, we're here to help. So if there's any of you who have any interest in chiropractic, we're more than happy for you to contact us. If you want to stop by, see the office, observe, spend a few hours here and observe, we'd be happy to provide that experience for you. So anyways, Ms. Fuscello, thank you so much for this opportunity. I know you do a great job, and I just appreciate all you do. And students, keep up the good work. I know high school isn't always easy, but you guys got this. So, all right, you guys have a fantastic day, and I appreciate the opportunity. All right, take care.